fast, female.
Cool. Hi guys, my name's Rayma. I am an obs and gynae specialty trainee, and today I'm going to be speaking to you about HPV screening, why it's important, and what normally happens on the day of your screening test. So HPV screening has different names. It can be called a cervical test, a cervical screening test, a smear test, a pap smear test. They all essentially mean the same thing. A smear test is essentially a test to detect abnormal cell growth in your cervix. And this normally can lead to cervical cancer. Cervical cancer's main cause is what we call human papillomavirus, a HPV virus. And this can be contracted through sexual activity. It's a type of STI, essentially. It can affect your skin, it can affect your mouth, your throat, and your genital area. Within the cervix, HPV can cause abnormal growth, and this can then lead on to cervical cancer. Hence why we do cervical smear test or a cervical screening test. When you're 24 and a half years old, you would have your first invitation. Then from then, every 3 years, you would be asked to come in until you're 50. From the age of 50 to 64, you would be asked to come in every 5 years. And when you're around 65 years old, you'd only be coming in if you've had an abnormal smear in the past. Now, what happens when you're going into a consultation, when you're going to have your smear test done? You would be met with a clinician or a medical provider, and they would guide you through the process. You would be asked to go behind some curtains and you would expose yourself from the waist downwards. You'd place a sheet on top of your legs. Your provider will have a speculum, they would have some gel, and they would have the specimen brush. And what they will do, put the speculum inside your vagina, open it up to visualize the cervix, and they would use the brush to collect the specimen. So that would just be around your cervix and within the cervical opening. They would just put the brush there, do a little twirl, and collect the specimens. And that's it. The whole process should take around 3 to 5 minutes, and you can normally get your results in around 1 to 3 weeks. If your results are negative, that's all good. That's what we like to hear. So you would go back to your screening process, and you would be asked to come in every 3 years or every 5 years, depending on your age. If your results do come back positive, you would normally be asked to repeat the test again. And if it comes back positive again, you may be asked to have another small procedure called a colposcopy. And that's essentially where they would once again visualize the cervix a little bit better, and they would have a look to see if there's anything there that's abnormal that needs to be removed or needs further treatment. Now, we urge everyone that has a cervix to do their cervical screening test because it's really important. It can prevent cervical cancer, which one can be easily detected, it can be treated, but if not, it can lead to detrimental issues, and we don't want that. So please do have your screening test. Thank you.